Do you suffer from disabling back or neck pain? Does pain radiate into your legs or arms? Have you been told that your back or neck may need spinal injections or even possibly surgery to decrease the pain that plagues you every day? Before you consider those options, you owe it to yourself to learn more about disc revitalization therapy. Too often people are turning to drugs, injections, and surgery for quick relief, not realizing they could be doing more harm to themselves in the long term. Hi, I'm Dr. Eric Schmidt, and I've been treating low back and neck pain for nearly 2 decades now. And over those very busy years, I became increasingly frustrated with the fact that many people were turning to invasive types of care, particularly spinal injections and surgery, way too early. And in many cases, simply because they weren't aware of a better option.
Nothing seemed to work. A terrible burning pain in my scapula, down my lat, into my forearm. I went on the internet and checked out surgery, and it was kind of gruesome. It was a little scary. I didn't know if it'd work on something like this, and it has.
Yeah, I was considering surgery, absolutely. If it goes wrong, it could be real wrong.
Pain radiating down my leg, to my feet, my toes. I had seen 2 different neurosurgeons to try to get my problem evaluated to see what I could do.
Drawing on the experience I had gained from exposure to nearly every cause of chronic neck and low back pain, I was able to formulate a therapy program that combines the most effective conservative care techniques into one unique treatment protocol I call disc revitalization therapy. Disc revitalization addresses all the underlying musculoskeletal causes of spinal pain simultaneously, with new research pointing to the damaged or degenerative intervertebral disc as the most common cause of chronic neck and back pain. It is our program's primary focus. Tissue decongestion. Without exception, inflammatory chemicals and scar tissue adhesions are lodged deep within the muscle and connective tissue. This creates that constant feeling of stiffness and pain familiar to many. Ultrasound therapy will deeply heat those tissues, facilitating nutrient-rich blood flow. Immediately following, a soft tissue instrument technique will be utilized to draw the inflammatory toxins to the surface so the lymphatic system can eliminate it. Disc decompression. Displacement of the gel-like substance within the shock-absorbing discs of the spine can cause the most severe pain, often impressing on nerve roots that radiate pain into the legs or arms. A computer-driven traction device is used to sneak up on the body, creating a virtually unperceivable pull that allows the muscles to remain relaxed as the negative pressure within the disc pulls back the bulging gel. The reduction in pressure upon the outer layers in the disc allows them to begin healing. Photobiomodulation. This describes the physiologic and biochemical changes brought about by the use of a Class 3B laser and microstimulation in the area of involvement. Cellular synthesis of healing proteins are increased by a factor of 6, speeding recovery dramatically. Microcurrent is provided in literally millionths of an amp. It also works on a cellular level to help stimulate the healing process. It is based upon the theory that the body's electrical balance is disrupted when one is injured, so that the natural electrical current of the body changes course. Microcurrent stimulation restores the natural electrical balance of the body, stimulates tissue regeneration, and improves lymphatic flow. Spinal stabilization. Pain and inactivity leads to muscle weakness. Specific types and sequences of exercise will target the intrinsic or core muscles of the spine, strengthening them, improving movement, stabilizing and protecting the spinal joints and discs. Dietary supplementation. During the process of revitalization, the body requires the immediate availability of specific nutritional components not normally provided by the average diet. The Revitalization Pack was uniquely formulated to meet those needs. Natural anti-inflammatory agents, as well as a research-proven combination of vitamins, minerals, enzymes, and herbs will optimize results along the way. Even if you feel you have already tried everything, traditional physical therapy, had some type of traction, seen a massage therapist, had acupuncture, or swallowed pill after pill after pill, disc revitalization may finally be the answer for you. It's the synergistic, simultaneous combination of multiple techniques that really makes the difference.
Just woke up one morning and I had a terrible pain shooting down my arm into my hand. I went for an MRI.
I was taking Advil, 6, 9 Advil a day.
I was taking medication prescribed by the neurologist.
I had met with a surgeon to possibly correct my disc situation in my neck.
I had 3 regular epidurals in my neck at different times.
Now that you know that a therapy protocol like disc revitalization exists, it's time that you or someone you care about schedules a free consultation at our clinics. We will be able to assess at that time whether or not you might be a candidate for this type of care. This program was originally designed to be performed prior to surgery or epidurals. However, we have also had successes with those who have had failed surgeries.
The mornings were the worst for me. Mornings, shaving was terrible, looking up.
I did not want to resort to having surgery or injections.
I woke up one morning and I couldn't move.
Oh, they're tremendous here.
I'm on the road to recovery and very happy.
Feeling probably back to about maybe 90%.
As a professional, I was skeptical. To my surprise, to my benefit, from my first day of therapy, I began to feel relief.
So I am happy that I made the decision that I made, and like I said before, you can't argue with results.
I no longer needed the medication to relieve my nerve pain. I could do my daily activities. I could get back to doing things that I enjoyed. I can get back to my normal work routine.
Don't look back and wish you had tried disc revitalization first. Call or visit us now.